So, of course, it's summer and what we consider the main trauma season, although I can say the same thing for the winter when there's lots of ice and snow. That's also another version of the trauma season, but definitely people are much more active. And so you get the lumps and bumps, you get the falls, the fractures, and a lot of these things are just very common. The children are out, they're on the monkey bars, the ATVs are out, you name it. There's water sports, summer activities, baseball, volleyball, you name it. Football practice is starting up. So as you can see, all of these things lead to, these accidents happening and these injuries which occur during all these activities. So the natural inclination is to go to the emergency room. So you want to know, one of the typical things with the emergency room is how high the bill is. And so one of the things that's happened is that you've had a lot of urgent cares springing up. And so I would say the simplest tip to lower your bill in the emergency room, if you have an appropriate injury, of course, the tip would be don't go to the emergency room and go to the urgent care. In particular, for orthopedic injuries, orthopedic urgent care. And you're going to get the best care for your orthopedic injury by going to an orthopedic urgent care. Of course, we run an orthopedic urgent care, but these are really around the country. If you search specifically for that, it's slightly different than, those that are marketed as just immediate cares, because, that would be, something like even if you had an earache or something like that. But number one, just from the fact that it's not in the hospital and there's no big facility fee, your bill's going to be cheaper. And then, chances are you're going to not wait as long. If you have an orthopedic injury and you come to us with your, for the orthopedic access, we're going to get you to the right person. So if it's in a fracture, a bad sprain of a particular area, we have the different specialties that will, address each area. And so that's kind of one of the issues people have too, going kind of bouncing between doctors that maybe it's not their specialty or they're not comfortable with this, particular thing. So coming to the orthopedic access alone will significantly decrease not only the bill, but also kind of the runaround, and we'll get to the appropriate person and, get quicker treatment, because ultimately the whole purpose is to get you back and functioning as normal as soon as possible.